Is a virtual journey to the doctor's office in your future?
Today on Future Forward, the future of health.
On-demand services, pricing transparency, tech-improved outcomes.
I'm Alexa Scordato.
And I am Steve Rosenbaum. Let us launch. Hey, Alexa.
Hey, Steve.
So, I want to believe this is going to be a good news show. Tell me this is going to be a good news show.
It's going to be good because last week we said I was going to pull up these links, and I did. And here we are. So if we say we're going to do something, we're going to do it. And
but here's why you are such a great co-host partner. Like, I thought she's going to send me these links and I'm going to go, oh, yeah, I know that. I know it's a little bit. I was like, when we do the first chapter, I didn't know any of those companies. Like,
yeah,
they weren't even on my radar. And that's because you live in we live in parallel but different worlds.
Well, up until recently, we lived like 5 blocks away.
Yeah. And now, so we should for our listeners do the where in the world is Alexa Scordato question. So we see
in Bordeaux, France.
Excellent. See, you should be holding a glass of wine.
Yeah, it's so funny. I'm wined out. So I was in the countryside eating foie gras and duck almost every single day. And now all I want is like a burger, fries, and a beer.
Well, soon enough. By the way, before we get into it, so we have 3 chapters today. The first is tech-enabled patient care. The second is pricing and transparency in healthcare. And the third is high-tech innovation. High-tech innovation, by the way, is a story that was brought to us by our friends at IEEE Spectrum. IEEE Spectrum is an awesome production partner. They've got a great magazine and a great organization, and we really love working with them. Okay, so let's just start with the links that you dug up, and what do they all have in common?
So a few years ago, I started thinking a lot about how technology is everywhere. There was that article, Software is Eating the World, and I just thought about all of these industries that were so ripe for technology to really help them transform. Healthcare for me is probably top of the list, maybe tied with education, but there's so much consumer education right now around like Coursera, Udacity, all these coding boot camps. For me, the healthcare industry is probably one of the biggest opportunities for technology to do good. And when people ask me about what companies I'm excited about, they're actually all companies in the healthcare space. And so we're going to talk about Forward Health, GoForward.com, Parsley Health, ParsleyHealth.com, and Maven Clinic. And so, Steve, you've never heard of any of these?
To be fair, I think I saw an ad in the subway for Forward, and it just didn't make an iota of sense to me. Pay more money.
What did you think it was?
Something where pay money for a doctor's office visit, something. It did not reach me. And I was on the subway for a long time, so it had its shot. So tell me.
Well, I'll summarize them all.
Yeah.
Forward, I first visited a Forward clinic in San Francisco, and it was one of those San Francisco moments where I was like, this place is not real. Like, everyone here is riding pogo sticks and scooters and, ordering cars on their apps. And sure enough, this doctor's visit, I wasn't a patient, but I toured the facility. It's almost like if you think of an Apple store and you have a doctor who's pulling all of your charts and vitals on a wall. And so you can actually see, what you weighed the last time, maybe what your blood pressure is. And it's really about improving the patient doctor experience for a visit. So it's a very tech-enabled doctor visit.
So instead of the doctor leaning over their computer, you looking at their back, they're putting everything up on a flat screen or a wall?
Yeah, like a TV, like a large HGTV.
That's interesting.
Yeah, you said the last visit you had, you stared at your doctor for, 75% of the visit?
I stared at the back of their head, yeah, for 75% of the time. But everything's going to come down to a math question. So, you pay for it out of pocket? Forward it's not covered by insurance.
Yeah, it's like a subscription, and so Forward's like that. Parsley Health is like that, and so is Maven Clinic. And so I don't know. I mean, there are a few trends I think that are coming into play. One is that you have the gig economy, the rise of digital nomads like myself, people who are working for themselves. I mean, you've been an entrepreneur and a business owner for a while. So, I mean, what do you use? What is your healthcare plan?
Aetna.
Aetna, and you just go to the marketplace like
Yep.
healthcare.gov.
Yep.
Do you like the choices you have?
Nope.
No one likes the choices that they have.
Nope.
And Oscar obviously made a big splash. And so I think what's just interesting is that they're increasingly more direct to consumer healthcare options now. And you can look at Forward Health, and I think their differentiator is sort of a very tech-enabled doctor. Parsley Health is similar to Forward. They're probably like the next biggest competitor. And what's interesting is when you go to their website, they really kind of focus on holistic healthcare. Like they're basically saying, don't just come to us because you want someone who's gonna just do your average annual physical. They're gonna say, we're gonna put together a nutrition plan for you. We're gonna put together an assessment of your stress management. Like they're basically trying to profile you like a whole person, which sounds so ironic that a doctor is innovative because they actually are caring about your health as a whole versus just checking boxes and doing something abstract.
So, just so I understand, so if I do I not need insurance if I've signed up for Forward or Parsley, or I need insurance on top of that?
I think you still need insurance on top of that because if something were to happen to you, like you needed a specialist or you were going to undergo surgery or go to a hospital visit, then the not having insurance, I think, would you'd have to pay a lot of money. It's also now illegal to not have insurance.
So Parsley says on its homepage, for less than $5 a day, get primary care with fewer prescriptions. And I read that twice, and I knew I was going to be talking with you today. So I was like, so is that a sales pitch? Like, we'll actually prescribe less. I mean, I was trying to, now that you explained it's holistic, I understand what they mean is less medicine and more treatment, more.
Right. It's
You know,
about more about preventative care. And so they're not really incentivized or they're coming from a place where they don't want you to take lots of medicine. They want you to be healthy. And to the extent they can isolate ways that you're living and things that you're eating or doing to prevent that, they will.
are you, I may be drilling into this further than you know the answers, but now I'm thinking about it. So there's always an interaction between my doctor and the insurance company. The doctor says, hey, I prescribed this. The insurance company says, we need a whatever, and they want him to write a. There's always like a push and pull between the doctor and the insurance company about what they'll cover and what he's recommending. How does a doctor at Parsley or Forward, like if they're not the primary on from Aetna, I'm a little puzzled by the model.
So I mean, I don't use them myself. I have friends who work at these companies, and it's the way I have learned about them or the way it's been explained to me. It's really direct to consumer. So you can have payment plans, annual or monthly subscriptions, and it's very transparent pricing. Like if you go to any of these websites, it's clearer than any single doctor website I've ever visited in my life.
And when you walked through the Forward offices, it felt good to you. If the vibe was positive.
Yeah, because I think there's an aspect of an experience design that has gone into these venture-backed companies. They are thinking about the patient experience from the web experience to the subway ads to the first time you step foot into the office and how you're greeted. And if we go into Maven Clinic, this does not apply to you, but they specialize in women's health. Like it's incredibly powerful to be able to have an app where you can text an OB/GYN for 15 minutes, and it's very transparent what 15 minutes is going to cost. I don't have the pricing chart in front of me, but it's something like $50.
Yeah. So my doctor says they'll text or email, but as I've come to dig into it, what I found is they can't find any way to bill the insurance company for those interactions, and so they really don't want to do it. So
Right. They don't have the technology either.
yeah.
So what's incredible about all of these companies is it's not the technology itself is not very transformative. It's actually the entire process and experience in terms of the delivery of care. It's almost like every interaction in between the actual diagnosis that makes it feel so innovative.
So by the way, at the bottom of the Maven website, it says sign up for Maven today for employers, for individuals, or for health plans. So that's interesting. So at least from our 30,000 foot view, it looks like Maven is, if they haven't solved the healthcare interaction, the healthcare plan interaction, they're working on that.
Yes. And actually, one of the coolest things I have to plug that they do is they actually help women transport breast milk. To say I have to go on a business trip, I can pump in Chicago and actually transport my breast milk back home to New York with me, or I don't know. I'm not a mom, but all of my friends who are moms say that this is like one of the most incredible things, incredible services.
So
like carrying liquids, security, it's like complicated.
Yeah. So all right. So let's move on to chapter 2 because it definitely is going to tie back to what we learned in chapter 1, and that has to do with pricing. And there's a swizzle to this, and we're going to play a little game together because I found we're going to test some pricing. But before we do that, there's a kind of a story you found that helps us get from on demand to pricing, and that strangely enough happens to be Warby Parker.
Yeah, so we're both wearing glasses right now. So if you don't know what Warby Parker is, they also sort of revolutionized the eyewear eyeglass industry by also creating a very patient-friendly or consumer-friendly experience. They are now allowing you to do your own eye exams instead of going in person or sending in a prescription. You download an app and you actually administer your own eye exam.
So does this not make every optometrist crazy angry? Isn't this essentially saying the thing that you make most of your money on, the thing that mostly makes patients come to see you, we're going to essentially disintermediate the medical professional and replace it with an app?
Absolutely, but it's like the next logical step. I've been wearing glasses since I was in 3rd grade, and I feel like my glasses used to cost my mom, I don't know, the price tag on them was maybe $250 sometimes for a pair, like in a regular old school optometrist office, and Warby Parker is like $99. Your glasses might be like really expensive though, Steve. They're really cool.
We'll talk about glasses pricing another day. But so have you tried this app?
I haven't. I actually did see an eye doctor recently, so I haven't.
Because what's interesting about it is that at the end of the article that we're referencing, which is Business Insider, when you use the app and then you get a prescription back from Warby Parker, it costs you $40. So that's what I pay when I go see my optometrist. So it's maybe a little more convenient than having to schedule an appointment and go and sit in the waiting room, but it's not any cheaper.
Yeah, I think it's just saving time.
So there's one thing in the article. Where is it? There's an interesting. Somebody got all bent out of shape. Here we go. This is the American Optometric Association. There's a quote from Sam Pierce, who's the president, and he says, "We are moving in the wrong direction of advancing standards."
Yeah, I don't know. I mean, I'm torn on this because it's like, in some ways, I can hear the sentiment, right? It's like a race to the bottom. But at the same time, the healthcare industry is dragging its feet in terms of providing transparent, quality, affordable care. And so if Warby Parker is sort of, I don't know, helping facilitate a more affordable, patient-friendly, convenient experience, then why not?
All right, so let's get to this. By the time this podcast is released, the White House will have announced its new pricing initiative, which President Trump announced with great fanfare on Friday. He said on Monday, I'm going to announce this new initiative that's going to increase healthcare price transparency with an executive order.
I read these articles this week and I was just furious. I was furious and I was confused. And normally I'm cautiously optimistic, but I don't know. I'm so curious to hear what you think.
Well, I think pricing is terrible. And I think that, I think that healthcare is a mess. And I think that, I don't think hospitals are pocketing tons of cash. I think what's going on is they're being squeezed on one side by insurance companies and they're being squeezed on another side by patients who come in that they have to treat that they have no recourse for. And so the people in the middle who they can make up a price for and then they're going to either get it covered or just pay it. I think the people who aren't careful economic consumers get, and the story is David Pogue's wife got this horrendous bill for an appendicitis, right? $10,000. And then he went online because he's a reporter and found out that it should have cost $2,000. So
has that ever happened to you where you got a bill and were surprised?
Yeah. I'm arguing with a provider now, not a doctor, but a facility about something minor that I got a ridiculous bill for, and I don't want to pay it, and the insurance company doesn't want to pay it, and the provider in question sent it to collections.
And so you're just waiting. Does it make you anxious?
No. I'm arguing. But it's taking cycles, and it's complicated. But neither here nor there. So there's only two puzzling. So let's talk about healthcare pricing, and then let's talk about is it possible that Trump could actually be doing something good on Monday when he announces this thing? So the first thing that's weird about this announcement is that the government essentially required hospitals to be transparent in their pricing a year ago. This is already an existing, I don't even know what it is, not legislation, it's
executive order.
Yeah, but before that, so hospitals confusing online price list gives patients a headache was an article from January of this year. This was a new federal rule that took effect this year, was supposed to make healthcare costs more transparent by requiring hospitals to disclose their prices to the public. So if this law already went into effect, federal rule already went into effect, then what's Trump announcing?
I don't know, but is this similar to when Obama was pushing for electronic medical records and it just didn't
happen?
It didn't happen overnight.
I don't know. So I'm going to show you a cool site, and then I'm going to tell you what I learned from it. So this is a site called Clear Healthcare Costs, clearhealthcosts.com, and it was built by a journalist friend of mine who literally ran into this issue and said, "Wait a minute, there's got to be a better way." And she built it. Her name is Jeannie Pinder. She's amazing. You can find her all over the web. She's an advocate for essentially price transparency. So
she has a TED Talk.
Yes, she has a TED. Yes, she and I were TED residents together. Where she was one cohort before me. So just for fun, I went into her site and I typed in nothing controversial. I typed in teeth cleaning, and I typed in my zip code. I'm doing it right now live for those of you who are able to watch. Oops, hold on. Somehow we got lost here. There we are. And now I'm going to search. And okay, so teeth cleaning, a community member listed, price charged $20, insurance paid $0, fine. And then there's a whole series of journalist checked prices that haven't yet been confirmed by patients, but it starts at $50, then it says $99, then it says $100, then it says $120. Then if we scroll down a bit, because it's getting boring, $184. If we scroll down a bit more, $335. We scroll down to the bottom of the page. Holistic Dentist, 17 Park Place, New York, New York. Price charged $400. How does that make any sense?
I mean, none of this makes sense, right? I think my first exposure to this is in college. I remember during freshman year orientation, they told us if something happens to you, like really try to avoid going to the emergency room, like calling an ambulance, because it's going to cost a lot of money. And I think that was like my first taste of being like, what does it cost? And what is a lot of money?
And what's the alternative? Call a cab?
Like, go to the wellness center on campus.
With like your arm bleeding or with a gash in your foot.
And I was like just confused by that. But
wow, that's terrible advice.
But all of these articles, I mean, I will admit, I have avoided receiving care or going to doctors because I didn't want to deal with a headache. Even when I have insurance, going through like an explanation of benefits process and even understanding vocabulary, in-network, out-of-network, PPO, what's covered, not covered, it kind of sucks.
So I called Jeannie Pinder and I said, look, there's this announcement theoretically coming out of the White House on Monday about price transparency. Isn't this exactly what you've been arguing for? Isn't this great news? And she said, yeah, theoretically, yes, but given how much we know the healthcare industry will push back and how much we know Washington doesn't seem to have the, my words, not hers, cojones to essentially, fight the battle. She saw it more as a press release than an initiative. That would sound right. What?
I mean, that makes me sad.
Yeah, well, I mean...
so what do you think, what do we think is the incentive behind it?
So,
It's just like pomp and circumstance, like, oh, we need better transparency, so we're issuing this executive order.
So there was a great episode of West Wing that I'll never forget, and it was called Slow News Day. And there was this great moment where the press secretary is interacting with some of the senior staff, and she says, we can't ever let there be a slow news day, because if we don't feed the beast will come chew on our leg. And so part of how you operate the White House, Trump obviously being not the old rules by anybody's measure, but part of the way you operate the White House is you have a whole agenda of things you're going to announce forever to essentially control the news cycle. In Trump's case, it's I'm going to lock up more children or I'm going to do more terrible stuff. But I think that someone made a list and somewhere on it was, price transparency. And he went, yeah, that sounds good. We'll do that on Monday. That's a summer story.
Yeah. In between potential Iran missiles.
Yeah. In between nuclear weapons. So let's move on to chapter 3 because this is a great story. So this is a podcast about technology. You and I both love technology. You started out by saying you think that the category where it could have potentially the most impact, is either education or healthcare. I agree. I went looking for a story for chapter 3 to back up your thesis with some real innovation and found this fabulous IEEE story about scanning your eyes for Alzheimer's. And
like ending on a high note, Steve.
The idea that, so there were all kinds of things in this article, that I thought were fascinating. One is the charity that is doing this research is funded by Bill Gates and Jeff Bezos, which maybe I'm late to the game, but I didn't know that they were in the charitable giving business together. So that's fascinating. And it's a big number. So the Alzheimer's Drug Discovery Foundation announced its first award from their $50 million Diagnostic Accelerator Research Program, which is funded by Bill Gates, Jeff and Mackenzie Bezos, although probably not anymore, and Estee Lauder CEO, former Estee Lauder CEO, Leonard Lauder. 4 recipients chosen from a pool of 300 applicants across 30 countries are developing reliable, cost-effective ways to diagnose Alzheimer's disease, including one that will use machine learning to detect early signs through an eye scan. I can't decide if it's Star Trek or there's just something so fabulously futuristic about putting your eyes into a scanner and then it coming out with healthcare, results.
Yeah. I so prefer this eye technology than face scanning technology.
Yeah, fair enough. So let's just read you another paragraph from the article. So it says, unlike heart disease and cancer, we lack a simple and cost-effective diagnostic tool and biomarkers that are critical to find ways to prevent and treat Alzheimer's disease. Once we have them, we will better understand how Alzheimer's progresses and make clinical drug trials more efficient and rigorous. I get that on so many levels. If you can't measure it, you can't solve for it, right? So,
yeah.
Now, having said that, I also had a moment where I thought, and I feel this way about a lot of genetic testing, does giving people information about something they have in an early stage when there's no treatment for it, I'm not sure that that's a good patient result, but...
are you saying ignorance is bliss? And so maybe if you have no good news, don't tell me any news kind of thing?
Look, if you tell me that in 20 years I'm going to die of a heart attack and then I get hit by a car tomorrow, turns out not so much.
Yeah, but it's good to have the choice to know that if you had knowledge that, in some period of time you were potentially going to be diagnosed with a disease, it might inform the decisions that you make. If you knew that you were potentially going to pass away in 6 months,
I would go
how would you live the next 6 months?
Would I go skydiving is what you're saying?
Yeah.
Okay, wait. I can answer that. No fucking way would I go skydiving.
You'd come drink wine with me in Bordeaux.
Honestly, yes, that I would do. Jumping out of airplanes, not so much. But what I liked about this story, and what I liked about ending on this note is, they're really, and this is I think where what drew us to this topic. I mean, in terms of patient care, there is innovation happening, at the direct to patient level. Didn't know about any of those 3 companies. Glad to know about them. Glad to know that they exist. Hope they all succeed. I guess maybe I would toss a coin on whether I think that, the guys that make, cheap but classy eyeglasses are the guys I want to be innovating in eye scanning or eye, whatever that is, replacing the optometrist with a test. But I'd like to try the test. I would. If they're listening, if their PR folks are listening, you could send me a link and I will be your guinea pig. I will try it and I will report back. And then last but not least, what I love about this story of $500,000 going to an eye scan system to analyze biomarkers is I can immediately see that having an impact on, R&D, on trials, and on healthcare. I mean, I can see that speeding the results of innovation in curing or treating Alzheimer's. And so.
Yeah, I think it's where my thoughts go, where I'll leave our listeners, is it's interesting to think about technology and change and who's really the catalyst for change. If you look at the the first few companies that we talked about in this episode, they're all venture backed. And then if you look at who's funding the research, or they're tech entrepreneurs, it makes me wonder if technology and change in industries can actually only occur from the private sector and outside the institution. Like where is the innovation on the inside?
But at the same time, it's a little scary to think, as opposed to the donors, when it's coming from venture says, how can we build something that's going to be profitable, right? I mean, that's their measure, is how do we get to a 10x return?
Yeah.
In any case, we are out of time. So have a glass of delicious Bordeaux for me. And
I'm sure there's some health report that will say
no,
one
no,
glass a day, right?
No. There's been all kinds of links that say, red wine, you live longer. With that, have a fabulous future week, and see you next week.
See you, Steve.